so much. This is Prostate Cancer Awareness Month, and right off the top, I'll just remind everybody I'm a prostate cancer survivor. Early detection was a big deal, but just since I was diagnosed, 6 years ago now, there's been so many advances in how to detect and to treat prostate cancer. Dr. Damon Smith joins us from Genesis Healthcare Partners here this morning to talk about that and to talk about this event this weekend that I'll be at, you'll be at down at Crown Point.
Yes. It's going to be at 8 a.m. Crown Point Shores, which is on the east side of Crown Point. It will be a 5K run. We'll also have a 1K or 1 mile run walk, which people who don't want to run a full 3.1 miles can do. It's going to be a nice flat run. Nobody will get lost. It's an out and back.
Which is a relief, yeah.
Yes. It's a beautiful course. It's right there on the east side of Crown Point, and you can see in the background here. You see on the video. This is a previous run that was done at another location. This year is our first inaugural event, but this is one of a group of 35 races around the country that are done every year to raise money for prostate cancer
Folks,
awareness.
we want to see you down at Crown Point. We want to see you there. We're going to kick the whole thing off at 8 o'clock in the morning. If you're a late registrant, can you...
You come down that morning and register, no problem. We're happy to have as many people who'd like to run.
So get there really early if you're going to be a late registrant. Otherwise, you can go to the website and sign up.
MyGenesisHealth.com is the website, and there's a link on there. You can sign up online. And if not, just show up in the morning and we'll be happy to sign you up.
You know, you and I were talking off camera, and this is usually how this discussion goes when I speak with a doctor that specializes in this. There's been so much in the way of advancements since I was diagnosed with prostate cancer and underwent a full prostatectomy, radical prostatectomy. A lot of guys look at that and they go, wow, that's the only option? You know,
right.
That or just ignore it? That's just not true anymore. It's really not.
Right. There are many options, and so my field in particular, I tell people all the time that I think that radiation oncology has advanced more in the past 20 years than any other field in medicine that I can think of. The technology has really taken off, and so men have the option of not having to undergo surgery if they don't choose to undergo surgery. A lot of men do want to undergo surgery. That works very well too. The point is that the cure rate is very high when we detect it early. For instance, when I started in practice, which is 20 years ago, over 40,000 men were dying every year of prostate cancer. That number is now down to 27,000 a year and dropping every year because of better diagnosis and treatment. On the other hand, we know that there's probably about a third of men who we detect who don't need treatment. And so we have some new tests available which are going to help to tell us who those men are.
Now,
so
that's
that we
a
don't
huge
need
number, and I want to just reemphasize that. About a third of men that are detected to have prostate cancer don't even need treatment. So
we don't believe so.
We don't believe so. So this is where the advancements are headed right now, folks, in that direction of not having to do anything, even if you're detected to have prostate cancer.
Or to watch it closely. Or to watch it, but ultimately never have to have it treated.
So you need to get into your doctor's office, guys. You need to be checked for this. About what age do you start checking guys for prostate cancer?
Well, it's for most of the population, it's age 50. For African American men, we actually recommend it considerably earlier, at 40 to 45.
Now, of course, no guy really wants to talk about a digital rectal exam, but it's still a necessary part of the procedure. It's quick. It's not terribly uncomfortable. It's just guys just aren't used to being in a vulnerable position like that. Let's be honest. But once that's taken care of, then you've got your PSA test. Is that still?
Yes, and that's still an excellent test.
And that's a blood test.
Yes, simple blood test, and then and that's about it. But we find that if you just do those two things and get it treated when you need to, then your chance of having a real problem with it is very low.
Yeah, this is not something that we should be dying from in these kind of numbers, guys. It's just something that we need to take care of. And women, if you're watching, talk to the guy in your life. Tell him, hey, look, I love you. Get tested. Yeah, okay, so you're a little embarrassed? Get over it. I want you to be around for our grandkids is what you tell them. So look, doctor, I will see you down there at, we'll get started at 8 o'clock, but if you want to register for this on site, you can just come down and do that early, or better yet, go to the website and get registered now so that we know you're coming and we can better count our numbers. Thank you
great.
so much for coming in.
Oh, my pleasure.
It's good
Very
to see
nice
you.
to see you.
And,
Okay, well, I'll see you on Saturday.
Thanks for all the great work. I can't
Okay,
wait to get down
good.
there. And as that T-shirt of mine that I told you is my favorite T-shirt, we're going to give prostate cancer the finger.
Right, yes.
So there you go. Thanks, Doctor.